So what's your position on healthcare?
So my position on healthcare is a very interesting one. And it basically goes down on health to the point that we need to recognize that the body is a very complex system. So you're looking at someone, who has 4 degrees from MIT. My PhD is in a field called biological engineering. And biological engineering was created to start understanding the body as a system. If you've looked at some of my videos, you also know that I also studied traditional systems of Indian medicine and other medicine, where we always saw the body as a system. So if you look at the body as a system, what you find out is it's a very complex system. Like your immune system is not just one piece. It's got 5 different components there. I'll just repeat again. Right? So the immune system is a very complex system. And so I've studied it for a large part of my life, and what it reveals to you is the body is a very complex system. And to think that government can tell everyone should get all these same vaccines, or everyone, oh, it's good, healthcare, we have ambulance and police calling back, right? But the point is, because the body is a very complex system, the government should not be telling top-down medicine. Okay, everyone should get this drug. If you have diabetes, you should take this drug. If you have Alzheimer's, you should take this. If you have a child, you got to give that kid 32 vaccines. That's called one-size-fits-all medicine. What we need is precision and personalized medicine. I give talks all over the world. I'm invited, because I'm an expert in that field, to talk about the right medicine for the right person at the right time. Now, that kind of medicine is not going to come down from a top-down medicine. It's going to come down where we eliminate all the middlemen, eliminate big insurance, big pharma, and we start looking at you as an individual should be able to make a decision on what's right for you. No worries. You as an individual should be able to make what's right for you, but having a relationship with your doctor. It's called decentralized medicine. 80% of the stuff can be handled between you and your physician. He looks at you, understands you. Nowadays, most physicians don't even look at you. They don't, they basically are looking at a computer, typing in something. So we need to go back to that old school medicine, one-on-one medicine. And if we do that, we're going to get help. Because healthcare is not about health right now. It's about sick care. Trying to figure out how much they can extract out of you. So my view is, when you look at the healthcare model, this is what the right model is. You have a direct relationship with your doctor. It's called direct primary care. You pay out of pocket $50 to $75 a month. And then the remaining items, where if there's a crisis, like when you get auto insurance, you may pay about $100 to direct of these crisis insurance companies. So less than $200, you get the best health care. And it's a one-on-one relationship. So we got to eliminate the middlemen, which are big companies like GPOs and these pharmacy brokers, who basically inflated the cost of healthcare. They don't do anything except serve as middlemen. We go to encourage you to take care of your own health, have responsibility. You have a direct relationship with your doctor. That's how we get back to health. And if God forbid something awful happens, you have the crisis care. But the overall healthcare model should be around $200 or less, and you take responsibility for your health. And if every American does that, we get healthier and we lower the cost of healthcare.
That would be nice.
Yeah.
Probably almost $700 a month.
Yeah. It's ridiculous. And most of it you never really use.
Nope.
So that's what we got to get to. We got to get to healthcare.
It's just sad.
It's very sad.
They're into making money, not healing.
Yeah, and all of this was brought to you by lawyers and lobbyists, right? It wasn't done by people who actually care for the human. Anyway, thank you.
Yeah.
Vote for Dr. Shiva Ayyadurai on September 1st.